I'll just start by telling you a little bit about myself, just to kind of qualify. I am the director of the the adolescent portion of the Addiction Treatment Center at South Miami Hospital. I've been there about 10 years, a little over 10 years. I've been in this field for over 15. Prior to being at South Miami, I was the director at another adolescent treatment program in Bethesda, Maryland, right outside of D.C., a place called Suburban Hospital. And so I've really been doing this a long time, and I've dedicated my career to treating kids, teenagers who have problems with substance abuse and addiction, and more importantly, what Peggy said, trying to prevent kids from developing problems with addiction and really getting into it in the first place. So I'm happy to be here. I was recently selected to be on the board of Informed Families. I've been working with Informed Families for many years, and I'm very happy to be a part of the organization. It does great work, and I'm really excited about being able to participate. I'll start by saying that, Peggy just talked to you about some numbers about addiction. They say that roughly 10 to 15% of the population is addicted to some substance or another. I think that number is probably very underrepresented. It's really hard to get people who are addicted to acknowledge that they are addicted. So that number is probably higher. Marijuana is definitely an addictive substance, and we're going to talk today about kind of the new marijuana, what we know, new trends, new data, and why marijuana is something that we really need to be concerned about among our youth. As I said to you before, I've really worked my entire career working with kids, and marijuana is probably the thing that I battle the most. And it's really about, when you're talking about whether people are going to use drugs or not, you're talking about, do they see this substance as harmful? It's about perception of harm. And most people, many people, do not believe that marijuana is harmful. I see it with adults, and I certainly see it with kids. And I'll have kids tell me, no, marijuana is not addictive, and no, marijuana doesn't do anything to you, and it's not harmful, and it's natural, and all of that stuff that they tell themselves to make it okay for them to use it. And it's just not true. And we're getting a lot of data, and there's a lot of research being done, and we're finding that marijuana really does impact both adults and adolescents in a very negative way, but more importantly, adolescents because of their age and their lack of maturity and their, where they are in their brain development. And we're going to talk about that today. So I am very passionate about this. I think marijuana is probably one of the most harmful substances out there for kids today. And I really believe that. I absolutely believe that. I call it the sneaky drug. It's the one that nobody thinks is going to do anything to you. It's the one that kind of creeps up on you, and it's the one that oftentimes leads you into addiction and into other drugs. And we're going to talk about how marijuana is a gateway drug as well. Before I do that, I do have some handouts. I wonder if I should just pass them around, because I think they're going to be helpful to everybody. If you could just take one of these each and pass it along, I think that would be great. Got some handouts there that really explain addiction. I've got signs and symptoms and the progression of adolescent drug abuse. I've got a handout there that really goes over the physical effects of marijuana. And another one that I think is more signs to look for parents. And I'm going to do my plug, as I always do. How many of you have seen this book? Anybody has not seen this book? If you are a parent, if you work with children, if you just want to know more about how to impact this problem and raise kids that are drug-free, this is an excellent book. I'll pass it around as well. It's written by Joseph Califano, who is the founder and chair of the National Center on Addiction and Substance Abuse at Columbia University. It's got about 20 or 25 years of data behind it. It just came out recently, I think in the last year. I take it with me every time I speak. I encourage all parents to buy it. It's an excellent book, and not so much just the data that's in it, which is enormous, an enormous amount of data, but it's got incredibly practical advice for what to do with your own kids at home and how you can raise them to be drug-free. So take a look, and if you haven't read it, please do. So let's talk about marijuana. The marijuana that's around today, folks, is not the marijuana that was around 20 or 25 years ago. It is no longer being brought in from Mexico or Colombia or, Jamaica or any of the places that you might think marijuana was brought in. It still does come in from those countries, but it's a much smaller amount than it used to be. And the marijuana that's out there today that our kids are smoking is actually grown here in this country, and it's probably grown in your neighbor's house. It's grown in Kendall, it's grown in the Redlands, it's grown in Pinecrest, it's grown in Palmetto Bay, it's grown indoors in somebody's house under artificial lights where they can manipulate the environment, they can use very sophisticated growing methods, they can use hydroponics, they can do all kinds of things to create a substance that has become more potent, more addictive, and more harmful to our children. Okay, marijuana is a plant. It's naturally occurring. It is classified. Actually, most drugs are either classified as a stimulant or a depressant or a hallucinogen or some other classification. But marijuana actually falls under different classifications, which is different from other drugs. It's a stimulant in small amounts. It's a depressant in larger amounts. And it's a hallucinogen when it's taken in very large amounts. So actually, when someone smokes marijuana, it acts to stimulate the central nervous system in small amounts. We've seen research that shows that it actually increases heart rate and it raises blood pressure. So when you first smoke marijuana, it begins to work on you immediately. You feel this effect, this euphoric effect. And it begins to increase your central nervous system, your heart rate specifically. And so there's a lot of research out there that's showing that those that smoke marijuana regularly, the chronic marijuana smokers over time, are more prone to heart disease. In fact, in the first hour of smoking marijuana, I read a study that said that in the first hour of smoking it, your risk of heart attack goes up by 4 times what it usually is. And again, that's just because it's acting to increase your heart rate, your blood pressure goes up, and your risk of heart attack is obviously greater. So in larger amounts, it acts as a depressant. So it actually slows down your central nervous system, kind of does the opposite of what it does in smaller amounts. And then again, in larger amounts, it can act like a hallucinogen. It can make you hear things, see things that aren't really there. And we are seeing folks today that are smoking this more potent form of marijuana that are having these hallucinogenic type of experiences. In fact, it's not uncommon for me to work with teenagers and young adults who will have psychotic episodes, will actually go into almost a schizophrenia-like mental state because of the use of marijuana. And we'll talk more about that later. Let me talk to you about the active ingredient in marijuana. It's delta-9 tetrahydrocannabinol, THC for short. And this is the ingredient in marijuana that gets you high. So it acts on that pleasure center part of the brain. It goes into the brain and releases neurotransmitters, specifically dopamine. Dopamine is a neurotransmitter that we all have occurring in our bodies, in our brains. Dopamine is actually responsible for the feelings of pleasure that you get when you do something that you enjoy. Anything that you enjoy. For me, when I go home at night, I like to eat a little chocolate, I probably eat it too late at night, which is bad, but I enjoy it. It makes me feel good. Well, all substances of abuse act on that same part of the brain. When you eat chocolate, a little bit of dopamine is released. Makes you feel good. When you use marijuana or use some other drug like cocaine or heroin, it floods your brain with dopamine. So it's kind of like chocolate times 1,000.